Hi everyone, let's begin with the rapid revision of mycology, which is undoubtedly a very important chapter, especially after COVID. So I've tried to make it as image heavy as possible because with mycology, if you know the image, you know the associated findings and you'll be able to solve the questions. Let's get going with a short but a crisp and concise, much needed mycology discussion. We'll start first that every cell wall of any fungus is going to contain something called chitin, and every cell membrane is going to have ergosterol. However, is there any organism in which ergosterol is absent, and that organism is pneumocystis, which we'll be reading right at the end. So remember, all of them have ergosterol, but pneumocystis does not. All the cell walls have what? They have chitin. What is the classification of fungus that you studied? Number 1, yeast. Yeast, as you can see over here, yeast is the form that is going to have just buds in it. You can see the presence of budding, and that is going to be a yeast. So what is included in a yeast? The most important thing that you have is cryptococcus. That's a yeast, a true yeast, what we call. Next, we have yeast-like. Yeast-like, you can see that definitely there's a budding, but there is also a long pseudo-hyphae that is coming out. So if you have a bud, and along with that you have a pseudo-hyphae, that is going to be a yeast-like organism. And what are the two yeast-like organisms that we have? Pseudo-hyphae, I always think of Candida, and along with that Malassezia. So Candida and Malassezia are yeast-like. Then we come to the true hyphae. The true hyphae become all the others that are molds. And finally, we have the dimorphic fungus. What is a dimorphic fungus? The one that can exist in the yeast form as well as the hyphae or the mold forms. So remember the mnemonic for this. Yeast is going to occur at heat and mold is going to occur at cold. So yeast is going to occur at a higher temperature of 37 degrees. And mold is going to occur at a lower temperature of 22 to 25 degrees. So yeast is heat, mold is cold. Both of them are existing. That is a dimorphic fungus. What are all the dimorphic fungi that we have? Remember the shape. Body heat probably changes shape. These are all the dimorphic fungi. Please enlist with me. B for blastomycosis, body heat. H for histoplasmosis. Probably has two things. Penicillium marnifi and paracoccidioidomycosis. If you've done paracoccidio, then C becomes coccidioidomycosis. And finally, the S is going to be for Sporothrix schenki. All of these, because I told you, dimorphic fungus is going to exist in heat form also and in cold form also. So yeast and mold both, that is why body heat probably changes shape. Done with the classification, let's go into all the different stains that you have in this. So whenever the fungus starts looking black, what is the stain that you've used? Gomori methenamine silver, because I know for a fact that wherever I've used a silver stain, undoubtedly I shall get a black color to the fungus. So all the fungus turns black. The next stain where all the fungus has turned pink. So think, what is the stain that turns everything pink? And that is going to be the P for pass, P for pink. That's another stain for fungus. Next we have, why has the fungus suddenly turned fluorescent? What is the fluorescent stain for fungus? And that is the calcoflower white. Please note CFW. CFW means calcoflower white, and that has the word flower in it. So you will know that yes, this is a fluorescent stain that you have. Coming to the next two stains, you have something called this rose pink color that is coming, that is mucicarmine. And then there is a negative stain that has been done over here. This negative stain is the India ink or nigrosin staining. Why am I taking these two together? Because both of them are used for which organism? Both of them are used for cryptococcus. So please note, cryptococcus skin in mucicarmine also, India ink also. How do I know which one to use? I hope you all remember that this India ink or negative stain, whenever you have a CSF sample, you are going to take the India ink or the nigrosin stain. But whenever you have a brain biopsy sample, you are going to go in for mucicarmine. So these are the two that you have for cryptococcus. What is the culture media that we use? The culture media that we have is the SDA, Subout's dextrose agar, done. And if from this culture, if I want to see something under the microscope after this, like from the culture guys, I want to do a morphology study. What is the blue color stain that you use? LPCB, lactophenol cotton blue. So quickly, black color GMS, pink color pass, fluorescent is calcoflower white. For cryptococcus CSF sample here, you do negative staining. If you have a biopsy, you do mucicarmine. For all the fungal organisms, it's SDA. If you want to look at culture morphology, LPCB, lactophenol cotton blue. Now let's go on to the classification as per the basis of the site. So first we start off with all the superficial mycosis. What are the superficial mycosis going to be? We have two things coming up. Tinea versicolor and all the dermatophytes. One by one, I'll take up this slide. So superficial में आएगा Tinea versicolor and dermatophytes. Let me start off with the first one on the superficial, that is Tinea versicolor. How is the patient presented? The patient is presented with these hypopigmented lesions. Can you see this hypopigmented lesion over here? Yes. So that is going to be the hypopigmented lesions. When I do a skin scraping, and what is this? Why is it so transparent? Because I have used 10% KOH. When do I use KOH? K for K. Whenever I want to digest the keratin. For keratin digestion, I am going to use KOH. And what do I see over here? The famous spaghetti and meatball. So I can see, guys, there is a cluster of round balls. This must be the meatball. And then there are long structures, which is spaghetti pasta. So spaghetti and meatball appearance. And in case you're vegetarian, it is the banana and grapes appearance that we are seeing over here. Why? Because if you remember, Tinea versicolor is what? It is nothing but Malassezia furfur, isn't it? So when you're talking about Malassezia furfur, was it a yeast-like organism? Yes, it had the round wala form also, and it had the pseudohyphae also. So it shows you spaghetti and meatball or the banana and grapes appearance. So much of food item. So if you want to cook spaghetti and meatball, you will need a lot of oil, but I want you to have healthy oil. So what is the culture media that you use over here? Over here, guys, we use the very famous SDA with olive oil. That is what we are going to use. So we prefer the SDA with olive oil. Is there any reason that I'm going for olive oil? Because this organism loves fat. It is a fat-loving organism, lipophilic hai. So you will need some oil. This is the question that you get, which is the fungus that doesn't grow on a regular SDA. You need an olive oil in it. And if you are cooking something in olive oil, it's going to get fried. So what kind of colonies do you get? It's the fried egg appearance. So now we see all food-related stuff happening here. Spaghetti and meatball, banana and grapes, olive oil is being used. You're frying the eggs in olive oil. Can you tell me which bacteria was showing you fried egg colonies? So ek to fungus mein to you have done M for Malassezia. But remember, the bacteria was Mycoplasma. So Malassezia and Mycoplasma show you the fried egg colonies. This was the first superficial. And how do you treat it? What do you do for topical treatment? Guys, we either put a 10% sulfur ointment. We also use a 1 to 2% imidazole creams. If it is systemic, of course, then we can go in for itraconazole and fluconazole. That is if there is systemic involvement also. But in most of the cases, it is topical creams that do the job. The second one that you had in superficial were the different tinea. So first you tinea nigra. Nigra matlab there's going to be something black. Of course, I can see a brownish lesion over here and over here. So there are brownish patches that you see on the palms and the soles. And when you look at it under the microscope, of course, you can see the brown color over here also. So what is this tinea brown nigra? Because of horte wernicki. Whenever I will use the word hot matlab something is hot. So matlab it's becoming black or brown. Whenever you heat something, it becomes black or brown. So whenever horte word will come, something black will come. That is horte wernicki. And how is it going to be treated? Again with topical imidazole. There's another thing. This was all skin related. When there is hair shaft involvement, what is that known as? That is known as piedra. So if there is black color ascospores, you call it black piedra. If there is white color ascospores, you call it white piedra. Which are the organisms for it? So remember trichosporin bijli, because bijli is white in color. Bijli in the sky during lightning or bijli is white in color. So trichosporin bijli is white piedra, and for black you should have some horte wala word, ma'am. So remember, piedra, horte, hot is going to make something black. Easy to learn. Bijli is going to make it white and horte is going to make it black piedra. The hair shaft is also done. Over here again, the treatment that you're going to do is topical imidazole, that is here. So abhi tak everything topical imidazole. Here, because there is hair involvement, you are also going to make sure that you cut or shave the hair before applying the topical imidazole. Now let's move on to the next. We are still in the superficial layer, and the superficial layer has dermatophytes. Dermatophytes known as tenaces. What are the three organisms that come under it? I have always learnt it as telegram wala channel. Telegram wala channel means what is the short form? TME. Trichophyton, microsporum, epidermophyton. Trichophyton, microsporum, epidermophyton. I will be coming to their details. First, let us do all these tenaces ka clinical part. Have a look at these pictures. I told you it's going to be an image fest. So now when tinea affects the scalp, so when there is involvement of the scalp, you call it cap. Cap matlab capitis. There is tinea capitis. Now the same scalp is showing you lots of crusting. Can you see? If you zoom in, you will see there's a lot of crust formation. Now this time it is known as tinea favis, or in other words, they also call it the very famous Scutula. Scutula basically means that there is crust formation that has occurred. On the other hand, if you see there is something like a very, very boggy, very soft, boggy swelling that has occurred, now you call it a carrion. Carrion is their favorite previous year question. So these are the three scalp-related things in one place. Tinea capitis on the cap, scalp. Tinea scutula matlab crust. And carrion is going to be soft, it is a boggy swelling. Now let's come to the trunk area. So if there is the fungal infection happening in the trunk, you call it the tinea corporis. Corporis basically means there is involvement of the trunk. In the next one, can you see aisa kuch goal, something round happening, something concentric happening like this? So now think logically or think from rhyming point of view कि अगर concentric हो रहा है, so concentric is imbricata, so tinea imbricata. And finally, if there is involvement of the nail, so nail is always going to stand for ungworm. So nail bed का involvement है, तो tinea ungworm. Simple. These are the corporis for trunk, imbricata for concentric and ungworm for nail. So now when I come to the table, what all have I studied? Tinea capitis was for scalp. Yes. Tinea favus, when that scalp gets thrusted and forms a scutula, that is scalp. What is carrion? Carrion is going to be something which is a boggy swelling. I've written some names also, which I'll come to. Now, what is corporis? Corporis matlab trunk. Yahan tak dekha tha, ma'am. And then what is the nail wala? Nail is ungworm. Others you might not, one more I'd seen imbricata. Imbricata is something which is to do with concentric. These photos I've seen. Others are self-explanatory. When I say tinea facie, facie matlab face is going to be affected. When I say Barbie, Barbie means the beard is going to be affected. Where's the problem? When I say pedis, pedis means feet. So the feet is going to be affected. That is known as athlete's foot. And when I say cruris, cruris means crura. Crura matlab groin. So this is known as the groin area called dhobi's itch or the jock itch, where the undergarments are worn. So remember the jock itch or the dhobi's itch. So these are two fancy words that they can ask you. Tinea cruris for groin and tinea pedis for the feet. Now, what are these tinea things that I'm saying? I told you learn a mnemonic that was trichophyton, microsporum, epidermophyton, and I'll give you a glimpse. Do you remember I gave you a mnemonic on my name and tried to act very smart? So I told you that you will differentiate these on the basis of two things, macroconidia, microconidia. Microconidia goes in descending order. So TME में it has trichophyton with maximum microconidia, microsporum has second maximum, and then we have hardly any in epidermophyton, decreasing order में जा रहा है. What is macroconidia? That is why I said now you will use my mnemonic. So what is the name of my Telegram group? TME for Telegram. Preeti Sharma channel. Preeti Sharma channel tells me that iska macroconidia is P for pencil. The next one is going to be spindle and the third one is going to be club shaped. Have a look at this diagram, guys. Now it's going to be simple. So first take the exam, tell me why is this blue in color? What staining has been used? This must be the very famous lactophenol cotton blue. So what you've used all throughout these is lactophenol cotton blue. Now I've arranged it in the Telegram wala group, TME. Trichophyton, microsporum, epidermophyton. And if I tell you how will you arrange the macroconidia? PSE. So like I said, when you're talking about the Telegram TME, you have to do Preeti Sharma channel. So chalo, let us think. Is this going to show you something pencil shape? Yes, I can see definitely there is a pencil shaped macroconidia that is forming over here. Pencil shape. Fine. After that we come to this one. Next one, PS, spindle. Am I seeing spindle shaped? Of course, these are beautiful spindle shaped macroconidia. And PSC. C for club. Am I seeing club shaped? Yes. So I can ultimately see all the three. Pencil, spindle, club. So macroconidia ho gaya, tick mark. Now I go on to microconidia. I had said descending order. So see, यहाँ पे there are lots of chota things. Lots of microconidia. Here also I have some small dots. Little many of them are there. But in epidermophyton it is soft. It is hardly gonna have. So I hope that is okay with everyone because now you will tell me the involvement. See, when I'm talking about trichophyton, so if I erase all of this, you will find out that, okay, ma'am, you are talking about TME. When I'm talking about trichophyton, all the three things are affected. This means skin involvement, hair involvement, nail involvement. All three are affected. Microsporum and epidermophyton में skin तो देखो has to be involved, but in microsporum it is hair involvement, and in epidermophyton it is going to be nail involvement. How do I learn that? Okay, simple. कि try में तो मैम try होना था, skin, hair, nail, everything, and skin is in everything. So remember, epidermophyton ends with N, so the nail involvement is seen in epidermophyton, and automatically we will see that the hair involvement is seen in microsporum. Let's move forward, guys. Out of these, if someone asks you what is the hair perforation test, it is done to differentiate these two between trichophyton rubrum and trichophyton mentagrophytes. What is hair perforation test? You are going to take a hair and you are going to put the organism, जो भी fungus है, you are going to put the organism in it, and you're also going to grow it and incubate it. You don't have to know the procedure. I'm just telling you there is a hair and there is an organism. I want to ask you which organism will perforate the hair, and that is going to be mentagrophyte. So how will I learn this? Firstly, what does it mean? Can you see that this is a hair? Do you see any hair breakage, erosion? No, bilkul theek. Ma'am, it's looking like intact hair. But the next one, I can see the hair is being perforated. So remember, mentagrophytes looks like farna. Hair farna. Who is going to perforate or who is going to help in farna of the hair? So mentagrophyte farega. That is how we have learned. Mentagrophyte farega, that is hair shaft erosion will be caused by mentagrophytes, not by rubrum. Let's move forward. How are you going to take care of the treatment? The azole derivatives are the topical ones, and obviously we can have terbinafine or itraconazole being given for all except for tinea capitis. What is the oral griseofulvin ka drug of choice? You know that. For tinea capitis, it is going to be oral griseofulvin. For all the others, it is itraconazole or terbinafine which can be given, and topical drugs में the azole drugs are given. Now let's move on to, we've done the superficial ones. What are we going on to next, guys? We go on to the subcutaneous ones. What are subcutaneous ones? MRCS. Subcutaneous में MRCS आएगा mycetoma, rhinosporidiosis, chromoblastomycosis and sporotrichosis. The first one that we start off with is going to be mycetoma. You know this very, very famous foot. So firstly, when we talk about mycetoma, it can be caused by a fungus, and that fungus wala thing like E and F ko saath mein rakhna. If it is caused by fungus, you're going to call it eumycetoma. Whereas if it is caused by a gram-positive filamentous bacteria, you call it actinomycetoma. So A and B come together. So actinomycetoma is a bacteria, and E and F come together. So eumycetoma is a fungus. Okay? Now give me some examples of these names. So if I talk about this, I think these are the examples that must be coming to your mind. You do not have to learn all. Please note. क्या याद रखना है? So ma'am, wherever the word actinomyc will come, मतलब वो bacteria. Actinomadura madure, Actinomadura pilietri, Actinomadura alone. Actino, you know, had a cousin brother, na, Nocardia and Streptomyces. So all of these come together. The only thing that you have to know, Actinomadura, actino word matlab bacteria. Now the catch is, Actinomadura pilietri sounds pila, but is not pila. That is micro, now what sounds is not there. Actinomadura pilietri sounds pila but not pila. What is the color of granules that will come in the pus? They will be red color. So Actinomadura pilietri is actually red in color. Now coming to eumycetoma, which is the most common fungus that you have to know. We have Madurella mycetomatis. So इसमें सारा myceto word आ रहा है. तो eumycetoma, Madurella mycetomatis is going to be here. Which of them will you treat with antibiotics? Common sense, this is a bacteria, so this is going to be treated with antibiotics. You are going to use cotrimoxazole with or without amikacin for 6 to 12 months because bacteria I treat with antibiotics. But for fungus wala, it is usually amputation which has to be considered. There will be a question, it was not responding to antibiotics. If it is not responding to antibiotics, of course, this is a case of a fungal infection. Out of these, the picture that you will get is the picture that I have shown you over here. You will see a foot and there will be multiple discharging sinuses that will be mentioned. That is a very classical thing that has been put up over here, multiple discharging sinuses. Let's move away from the fungus and assume that it is a case of actinomycetoma. So, क्या appearance दिखता है? There's a very famous appearance called the sun-ray appearance. What is sun-ray appearance? Guys, all these blue color filaments of actinomyces, because I know that actinomyces is a gram-positive filamentous organism. It is a filamentous bacteria, hai na? So if it is a filamentous bacteria, it will show filaments like sun-ray. But then what is this pink color zone around it and pink color zone around it? This is known as the Splendor-Hopley phenomenon. So firstly, I'll have to explain to what is the Splendor-Hopley phenomenon. This is nothing but the presence of antigen-antibody reaction. So whenever the antigen and the antibody are going to react, it is going to result in the formation of this Splendor-Hopley phenomenon. Where else do you see it? Please remember, Splendor-Hopley phenomenon is not only seen in actinomyces, but in a while I will teach you a fungus that is Sporothrix schenki. There also this is seen. This pink layer is nothing but antigen-antibody complexes that are getting deposited here. So your MRCS mein mycetoma is done. What is R? R stands for rhinosporidiosis. Can you guys tell me what is the organism? Rhinosporidiosis is caused by Rhinosporidium seaberry, and now they are saying C se related, and now they are saying it's not a fungus. Now they've reclassified it. They are saying it is an aquatic organism. It's an aquatic protozoa. So that is how you'll remember. Rhinosporidium seaberry is going to be somewhere in the sea. And sea mein matlab someone's going to be swimming. There'll be a history of swimming, and where will it come in contact with? It will come in contact with the nasal cavity. So nasal cavity mein kya hoga? What is the patient going to come with? These polypoidal lesions known as the strawberry appearance of the polyps. And when you look at them under the microscope, you say, ma'am, hang on, why are you looking at them under the microscope? You mean to say the treatment is a polypectomy? Yes. The treatment is a polypectomy. So when you look at it under the microscope, you see ye bada sporangia. You see these huge sporangia, and inside them you see that dot. So zoom in, you see those big two sporangia, and then you see these dot. Ye jo dot hai, those are gonna be the endospores. So sporangia with endospores are noted, and that is what you see on polypectomy. You'll say very good, ab culture bhi karo. And that is the catch. Is it cultivable? No, this is a non-cultivable organism. So this requires a special mention, very important, rhinosporidiosis, non-cultivable. So MRC. What is C? Chromoblastomycosis. What is the other name? Chromoblastomycosis is known as verrucous dermatitis. Why? Because dermatitis means skin. Verruca means what? I can see that there is a warty growth that is present over here. So the other name of chromoblastomycosis is verrucous dermatitis. And when I look at the same thing under the microscope, I see the chromo word. Chromo matlab it's going to give some color, right? And that color is going to be the copper penny bodies. They look like beautiful copper coins. But do you think such a simple question will come? Copper penny ka photo and copper penny bodies? No, they'll ask you the other names. Sclerotic bodies, muriform bodies, and medullary bodies. Sclerotic, muriform, medullary, copper penny, all are the same. They are seen in chromoblastomycosis. But why is this person having a lesion over here at the first place? So please note, there is a traumatic implantation. He was walking barefoot. There is a traumatic implantation because this person is basically doing barefoot walking. So imagine he's a forest worker. He's walking barefoot. What is going to get pricked into his feet? And all the FFF wala organisms, listen to me. Fonsacia pedrosi and Fonsacia compacta, Exophylla, Phyllophora, Cladophylophora. Did you see that chromoblastomycosis has all Fonsacias? Exophylla, Phyllophora, Cladophylophora. Jitna bhi FFF is gonna come, that is then gonna make it the chromoblastomycosis, and they are gonna get trauma, say they are gonna get implanted. What is the treatment? You will have to remove it. Whatever this big lesion has formed, you will have to remove it. And number one, you are going to do a wide surgical excision. Sometimes it will leave a very big scar or an area. You might have to do a laser reduction also. And apart from that, you will have to give the patient amphotericin B and other drugs. Recently, even voriconazole has been sent, but amphotericin B pehle se hai, so that is always there. But voriconazole also has a role over here. So remember, flu cytosine, yes, again, yes, possible, but nothing can replace surgery. These are all drugs which are given side by side. So MRCS mein you will say, mycetoma done, rhinosporidium done, chromoblastomycosis done. This sporothrix I'm not doing. Why? Because the next family that I'm starting with is the dimorphic fungus. Body heat probably changes shape. Sporothrix is gonna come there also. Hang on. What did I say? Which is the fungus which can be dimorphic also? Number one. And which is the fungus which can work on a subcutaneous level also? Subcutaneous mycosis. So remember, sporothrix fits in both places. Let's start one by one. Body heat. So I'll write body for blastomyces. As soon as you say blastomyces, what are the other names? It is, instead of blastomycosis, it is called as North American blastomycosis. That is why it can also be called as Chicago or Gilchrist disease. And blastomyces looks like a B. B is 8. So what you see classically is the figure of 8 appearance. We see the famous figure of 8 budding that is noticed. That is blastomyces. Coming to the next, what are you going to do the treatment with? Guys, for the mild disease, we give all fluconazole and itraconazole. And for disseminated, it is amphotericin B followed by itraconazole. Okay? So if it is the conazoles or azoles only for mild and amphotericin B followed by the azoles if it is a severe disseminated infection. Body ho gaya. Heat for histoplasmosis. What is the other name? I always used to say high for histoplasmosis, high darling, and this is also known as Ohio disease. So remember, this is going to be O high, so high darling ke liye histoplasmosis, high Ohio disease, also known as Darling's disease and also known as Cave's disease, right? So you will say that fine, when this histoplasma is going to come inside our body, who is going to, or what, when it comes in our body, how and which cell does it go into? That gives it its last name. It is known as reticuloendotheliosis. Very, very fancy name for what? Macrophages. So they ask you, where does it go and reside in your body? It enters the macrophages. Remember that. Who is the reservoir? This is another PYQ. It is basically associated with the bird and the bat droppings. That is a very important question. So the bird and the bat droppings which might have contaminated the soil, that is a one way of how it can also get, passed on to the human. So remember, Ohio, high for high darling. Now I had told you that histoplasma is a fungus and it behaves exactly similar to a bacteria, that is TB. Tell me, TB ke jitne bhi symptoms cough, sputum, weight loss, night sweat, same, histoplasma same. What is the necrosis for TB? Caseous necrosis. Histoplasma, same. So now when TB and histoplasma are such good friends, is there something related to TB that it can show you? It shows you these structures with these projections like this. These are known as tuberculate macroconidia. So it's taken a TB wala noun. Histoplasma shows you tuberculate macroconidia. What stain is this? Blue color wala stain, lactophenol, cotton blue. You can see the projections. This has come as a previous year question. Tuberculate macroconidia. What it also shows you is, can you imagine ye bada sa cell kya hai? Ma'am, you told us it always goes into the macrophages. Yes. Inside this bada sa cell, it has this ... So these are the chota wala form. These are the yeast form. So coming back, histoplasma can come to us as the chota wala form also, that is the yeast form. And on lactophenol cotton blue, it can also show me the tuberculate macroconidia. So body, heat, done. Now we go to probably. Probably means Penicillium marnefi. Now it is also referred to as Talaromyces marnefi. As long as marnefi yaad hai, it means the same. Marnefi, what was the story we did for it? So you're going to take a broom or a brush and Marna, whom are you going to hit? You're going to hit a rat in your house. A rat has entered your house. Means who is the natural reservoir? There is a bamboo rat which is a reservoir. So you will say, Pam, a bamboo rat has entered my house. I marna padega. Marna matlab marnefi. Kaise maroge? You're going to hit it with a broom. So what is it going to show? On lactophenol cotton blue, can you see? It looks like a brush. The conidia looking like a brush. So it shows you the broom or the brush appearance. So kisse maroge? You're going to hit it with the brush or the broom appearance. How will you hit it? I will hit the rat so much that it will turn red. Maar ke lal kar dena. That is what we said. The rat is going to turn red. So what is the pigment that it produces? It produces a red pigment. So simple. First you will say, I'm doing marna. Kisse marna? There is a rat that has entered my house. Kaise maroge? I'm going to pick up a broom or a brush and I will hit the rat till it turns red. So marnefi, bamboo rats, broom, brush appearance and red color pigment. Body, heat, probably. There was one more P known as paracoccidioidomycosis and this is known as South American blastomycosis. Hang on. There was a North American blastomycosis and now there is a South American blastomycosis. So simple. North comes above. To pehle mante. South comes, so not south mano, no, north is above, south is below. So take the first alphabet, this is known as just blastomycosis. Whereas this will be known as paracoccidioidomycosis. So go alphabetically, north comes above, south comes below. So B comes above, P comes later. North wala is blastomyces, south wala is paracoccidioidomycosis, and that shows you PPMM. What is PPMM? Please note P for paracoccidioidomycosis, P for pilot wheel appearance, also known as MM, mariner's wheel appearance and Mickey Mouse appearance. So ye dekho, this one, is it looking like a pilot wheel or a mariner's wheel? Yes. And is this looking like a Mickey Mouse ka classical face? Correct. So what did I say? PPMM, paracoccidioidomycosis, shows you pilot wheel appearance, known as mariner wheel appearance, known as Mickey Mouse appearance. Okay, para mein se para hata do, what are we gonna left with? We are now left with the coccidioidomycosis. I've started ulta. I started with the treatment because that is a more famous question. But the treatment is the same everywhere, na? We were saying if there are mild diseases, you're going to give the azoles. And if there are disseminated infections, first you will give amphotericin B followed by the azoles. I don't know why for coccidio particularly they like to ask the treatment in pharmacology, but they do. Azoles and otherwise amphotericin B followed by azoles. So kya hai ye coccidioidomycosis? We always learnt it as ABCD. What is this C? C for coccidioidomycosis. What is the D? The other name of it is desert rheumatism. It is going to be associated with some desert in California or some valley, some Arizona, California valley. These kind of histories will be there. So yaad rakhna. D for desert or valleys or California. This is what is going to happen. And why rheumatism? Because it also shows you joint involvement. So remember, coccidioidomycosis is deserts and valleys and California and Arizona. Udhar hoga. So what is the A and the B? Because it tends to show you the barrel-shaped arthrospores. It shows you barrel-shaped arthrospores. Barrel-shaped arthrospores. What is that? You can see these boxes. These are nothing but the barrel-shaped arthrospores. On what stain? On lactophenol cotton blue. What else? Can you see these round spherules? Yes, I can see these spherules, and these spherules have those ... that is going to be the endospores. The spherules have the endospores. Those can also be seen. So I can see the spherules, which is common, but a barrel-shaped arthrospore inka favorite photo hai. So what is ABCD? We see coccidioidomycosis, known as some desert rheumatism, desert valley, California, Arizona, and barrel-shaped arthrospores are seen. So tell me, body heat probably changes. Last one, Sporothrix shenkai. First, I want to draw a chota sa diagram for you. What is Sporothrix shenkai known as? It is known as the Rose Gardner's disease or the lymphocutaneous disease. Rose Gardner. Let us draw the life of a Rose Gardner. There is someone who is roaming around in the rose field. Wow, what a life. We are sitting in a room and listening to lectures. He's roaming around in the rose field. He's living the good life. What is the good life? That he has a nice sky full of stars, which we will never see where I stay in Delhi. AQI is pathetic. So this is a nice sky full of stars over there, okay? What else? As they depict in movies, good life matlab, there is a cigar in the hand. He has a cigar in the hand. So now let's see what all I can do around it. What is this Rose Gardner's disease? This is Sporothrix shenkai. So now when someone will carry a rose, to thorn prick to hoga. So what is the root going to be? The root is going to be a traumatic prick. That can occur on the fingers or the feet. So there's a traumatic prick, and this is going to result in a lesion where the prick will occur. But I'm saying that the nodules are spreading. How are they spreading? The nodules are on the skin, but they are spreading along the lymphatics. Please remember, this tends to show you a lymphatic spread. Very classical question. Look at it under the microscope. You will say, ma'am, please note, there's a very beautiful star. Like you said, stars will be seen in the sky. You see beautiful stars called asteroid body. But asteroid ke center mein dekho. Right in the center of asteroid, if you focus, you see a round color cigar. Instead of showing you the cigar like this, they've shown it to you like a dot. So remember, they are going to see in the center, we see a cigar body, and surrounding it, we see the projection. So together, it is known as an asteroid body. So what is their composition? The center wala dot hai, that cigar body, that is nothing but the yeast. And what are those pink projections on the outside? That I've already told you. Didn't I tell you that Sporothrix tends to show you the Splendor-Hopley phenomena? This means these are the antigen-antibody complexes. So remember, those stars that are formed is where else? Abhi kha pada tha actinomyces. Actinomyces shows you Splendor-Hopley. This also shows you Splendor-Hopley. Finally, ma'am, when this person, so I have understood Rose Gardner's disease. Cigar in his hand because cigar body, he's watching at the stars, so asteroid body. And one more thing, why is this more famous for being rose? Because look at the conidia. I see a rows of conidia, rosettes of conidia is noted. So rose is just not for rose gardener's disease, it is also for the rosettes of conidia that I get to see. So Sporothrix schenki also done. Before I end, where else do you see the presence of asteroid bodies? Please let me know. There are 2 asteroid bodies. Look at this one over here. This is lying out in the open. It has no association with any cell. It is extracellular. The next one is also an asteroid body, but I can see there's a big cell around it. It is intracellular. There is a giant cell, and inside that cell I can see an asteroid body is there exactly. So both of them are different causes. The one that is roaming around, the one that is extracellular, is going to be Sporothrix, because Sporothrix is rose gardener's disease. Now, rose gardener is obviously going to roam around outside only. So rose gardener is roaming outside, so the asteroid body is also outside. But sarcoidosis is granulomatous disorder. It's going to show you giant cells. So over here, the asteroid body is inside the giant cells. Sarcoidosis में asteroid body is inside. So simple. As soon as they say कोई star वाला body है, S for star, S for Sporothrix, S for sarcoid. S for star, S for Sporothrix, S for sarcoid. Sporothrix is rose gardeners, तो बाहर होगा, and sarcoid will be inside. All your dimorphic fungi are also done. What are the last thing that you have to do? But before I go on, I've got you a very, very super small table now. उसका भी smaller version. Quickly, blastomyces was North में, तो North American, Gilchrist or Chicago, and it shows you the very famous figure of 8 appearance. Histoplasma, hi darling, right? So this is going to be Ohio and darling. And what does it show you? Ma'am, TV jaisa tha. So this form is, it's going to show you all the macrophages with the yeast. And I don't want to show this to you once again, but now I have. And that is going to be tuberculate macroconidia. Coming to Penicillium marnifi, of course, you know there is a broom or a brush appearance, and who were you hitting? You were hitting the bamboo rats. What is it also known as? Talaromyces marnifi, and marke, you were making it red, so there's a red pigment. Paracoccidio, now come to the south. It is South American, and we said PPMN. Paracoccidio is showing you pilot wheel, mariner wheel, or Mickey Mouse. You can see pilot wheel, mariner wheel, and Mickey Mouse appearance. Coccidioidomycosis is known as the desert California, Arizona valley fever, matlab ABCD. This was known as desert rheumatism, and what does it show you? These boxes, barrel-shaped arthrospores. Finally, Sporothrix schenki, the good rose gardener's life. So you will see a rose gardener, and apart from that, you will see that the conidia are also rosettes of conidia. How is it going to spread? Lymphatic spread. And kaunsa wala body? Ma'am, center mein cigar hoga, and around it there are stars. So there is a cigar body seen, and there is an asteroid body seen. This is a super quick 2-minute wala review. This might help you in the end. And if you look at the snapshot, most of mycology has been done in this manner, which makes it even more rapid for you to revise. The last part of mycology that we start with is going to be the opportunistic infections. All these occur in HIV and all those things. So let us start. Let us start with Cryptococcus. What are the 2 types of Cryptococcus that you have? Cryptococcus neoformans and Cryptococcus gattii. Please note, gattii, T-T-I-I. T-T matlab it is going to be seen in tropical and subtropical countries, whereas Cryptococcus neoformans is seen around the world. So remember, we have tropical TT, tropical and subtropical countries. After that, what is II? It is going to be seen in the immunodeficient and immunocompetent people. Sab mein dikhega, normal may be, competent may be, and compromised may be. But neoformans is seen primarily in immunodeficient people like HIV. So HIV positive mein jo infection hoga, that of neoformans. So simple, gattii is tropical and subtropical, immunocompetent and immunodeficient. Finally, this gattii has so many T's that I will say that it will be related to a tree. Where is it found? It is found in the soil around a tree. So there's a eucalyptus tree, uske soil mein you will find this T wala organism. Whereas what will you find in association with the pigeon droppings? So any pigeon dropping that goes into the soil, that is going to be Cryptococcus neoformans. Thankfully, Cryptococcus neoformans has a good response to antifungals, and this gattii is going to give me a tough time. Sab kuch T se tha na, so this is going to give me a tough time because this is going to be a resistant, that is going to require a prolonged treatment. So basically what we always have in HIV patients is Cryptococcus neoformans. And what is the disease that I'm talking about? We usually refer to meningitis. So let's assume that we have a Cryptococcus meningitis ka case. तो क्या sample लोगे? CSF लेंगे ma'am. If you have taken a CSF sample, what is the stain that you're going to do? we do the very famous negative stain, that is India ink or nigrosin. And if I zoom in, we can see that yes, the capsule, see the problem kya hai? Negative means I have like a negative of that photographs we used to have many decades ago. Na? The background is stained. So the capsule will shine out. So you're not staining the capsule, not at all. Remember, the capsule is going to be unstained. हमने capsule तो नहीं stain किया. We have stained the background. The background has been stained with a color. Ulta. That is known as a negative staining. That is India ink or nigrosin, provided you have got a CSF sample. Guys, what if there was a brain biopsy that was done? If a brain biopsy has been done, what will we be using? Mucicarmin, which gives you this red color, rose, pink, red wala color. So remember, read the question carefully. Cryptococcal meningitis में CSF sample आया, mark India 1. Biopsy आया, mark mucicarmin. But what is the culture media? It is something which is a little brownish. Everything has turned brown, ma'am. That is because brown matlab Niger word will come. So bird seed, Niger seed, agar. But why has it turned brown? Niger words I will find out. Brown hai, theek hai. But why is it brown? Because of an enzyme called phenol oxidase or lacase. This is ratta that you'll have to do. Theek hai? Phenol oxidase or lacase is what has made it that brown color. So bird seed or Niger seed agar. But forget all this. What is the most confirmatory for cryptococcal meningitis? It is latex agglutination test. Latex agglutination test is the most definitive confirmatory diagnosis. And also, what is the treatment that you're going to have? It is amphotericin B. So liposomal amphotericin B with flucytosol is something that is used in the treatment. So first wala ho gaya, first opportunistic infection, that is cryptococcus is done. Let's move on to the next one, and that is Candida. Candida may I start off from pathology. What was this that I taught you in pathology and also in gynecology? If you have a person, a female who comes with a curdy, dekho the way you are writing. How are you writing? Candida. Try to make everything with Candida ka C over here. So what do you see? CK, Candida mein rakhna, curdy white discharge. And what is this pap smear wala finding that you find over here? You took a pap smear out of it, ma'am. We saw the kebab, shish kebab effect. What is shish kebab? So first you will say, what is that stick on which all the kebabs are kept? Candida hai, so of course it is going to have pseudohyphae. And then after that, what are those pieces of kebab over here? These are the cells of the cervix. So I can see over here, line say, why are all the cells in a line? Because they have decided we will make a shish kebab effect. That is what you see. So remember, C for Candida, C for shish kebab, K for shish kebab. So remember, Candida, kebab, curdy white. Candida, kebab, curdy white discharge. Now let's look at all the other tests that I can get. Now I just told you that Candida will have budding and pseudohyphae. Dekh lete. Ye dekho, if I see chota buds coming out, if I see small buds coming out, that is budding. And just pull the bud. If the bud is a little small, I pull it into such a long thing, it becomes a pseudohyphae. Simple. So this small thing is going to be a bud, and this long thing is going to be a pseudohyphae. That is what Candida shows you. Next, let's grow it on an agar. Agar for everything is what? SDA. Candida क्या show करता है? एक rhyme बोलते हैं, like kids. Creamy, pasty, yeasty colonies. What is creamy, pasty, yeasty? Creamy matlab, look at the color. It's a little off-white cream. Pasty because it looks like toothpaste, pasty की तरह है. And yeasty, you smell when bakeries में वो जो bread baking का smell आता है, because in bread baking you use yeast. Same kind of smell comes. So creamy, pasty, yeasty colonies is what is going to define Candida. But Candida में कौन सा agar? You use this agar map which is very colorful. Candida में chrome agar use करता है. So see, Candida number 1 had curdy white discharge, had kebab effect, has chrome agar. Okay, all this is done, and you don't have to know which color is for which Candida. That is not important. Now let me ask you, which is the spore that Candida will form? Chlamydospore. एक और K आया. How will it? What is a chlamydospore? You will say, ma'am, ये जो double wall दिख रहा है. It has an outer wall to it and it has an inner wall to it also. Can you all see? So chlamydospore is something which is going to be double walled. So chlamydospore is formed on which agar? It is formed on cornmeal agar. So Candida में chlamydospore formed on cornmeal agar. Finally, coming to the last one, which is the very famous germ tube test. Set question has to come. Germ tube test known as Reynolds Broad phenomena. What is a germ tube test? That if you kept a candida, no one will ask you firstly the procedure. Listen to me for your clarity. If you keep candida with some growth factor, like hamara blood dal diya, serum, or any growth factor you add, you will see that a germ tube will be coming out of it. It will give birth to a tube basically. That is known as a germ tube test or a Reynolds-Broad phenomena. Before I go into the theory, everyone, Candida is going to show you a curdy white discharge, is going to show you the famous kebab effect, is going to be grown on the very, very famous chrome agar, that is very important, is going to show you chlamydospore, on which agar? Corn meal agar, and is going to show you germ tube test positive. But do you know Candida has a cousin brother? Candida albicans is what I was talking about up till now, but Candida albicans has a brother called Candida dubliniensis. Dubliniensis matlab it is going to do everything double. That I will follow my brother. My brother is showing germ tube test positive, so double kar do. I will also show. My brother is showing chlamydospore on corn meal agar, I will also show. सब कुछ तो सेम नहीं हो सकता ना. Albican says, wait, I am elder brother. I am the dominant one. I am elder brother. I have more responsibilities. I will be surviving for a longer time. I will be, take up responsibilities very well. This is younger brother. वो कभी कभी copy करेगा, कभी कभी he's gonna chill out in life. So now if I ask you कि copy तो कर लिया, both of them show you germ tube, both of them show you chlamydospore, but who will grow at high temperature? The elder brother will have to take the responsibility. Who will grow in hypertonic saline? You put a little bit of stress, and who is gonna grow? It is gonna be albicans. The elder brother has to grow, whereas dubliniensis says, "Arey bas, now my responsibility is over." Okay, albicans is the elder brother who takes all the responsibilities. Dubliniensis only takes the germ tube and chlamydospore. It does not grow on hypertonic saline. It does not grow at 45 degrees. Candida is done. Okay, if I ask you quickly the treatment for all the Candida, talking about oral thrush or talking about diaper rash or vulvovaginal candidiasis, what do we prefer? It is topical nystatin. When we are talking about severe candidiasis, we can, other than nystatin, use fluconazole. For deep candidiasis, it is liposomal amphotericin B, and of course we have the azoles which can be given. So depending on the site and the extent of candidiasis, the treatment is decided. So Candida bhi ho gaya. What is the next one that we are going to come to? I'll show you a picture. Maybe then you can identify. Yes, aspergillus. So I can see lungs mein kuch aspergillus has caused. In the ear canal also it has caused something. So what are the different aspergillus things that can come up to us? Number one, allergic bronchopulmonary aspergillosis. What is this? Very famous previous year question. Allergic bronchopulmonary aspergillosis. Firstly, you will say that ma'am, allergy hai to hypersensitivity to one hoga hi hoga, but also antigen antibody reaction occurs. So it is a combination of type 1 and type 3 hypersensitivity. What else does it cause? It causes aspergilloma. What is aspergilloma? Aspergilloma, many people believe that aspergillus has gone and caused a cavity. Nahi, aspergillus cavity nahi banata. There is a cavity already present in the lungs. Imagine patient had TB 10 years ago, or had a cancer 2 years ago, or had some other infection. Cavity is already there. So there was already a cavity. Aspergillus just said that I'm going to go and sit inside that cavity. Space is there, let me just go and sit inside it. So aspergilloma is fungus going and sitting in a pre-made cavity. Coming to the next one, invasive aspergillosis means it has gone all over the body in the blood. It is roaming around in the blood to invasive. And superficial means when it is involving the ear, that is otomycosis. That is the picture that I had for you over here. So it can be ABPA, aspergilloma, invasive, or superficial, that is otomycosis. So kaisa dikhega? What is the classical feature you have? See, the way you say aspergillus, A se kya pata lagega? A is gonna stand for the very, very famous acute angle branching. So if you look at these, you can very well appreciate that the branching is happening at less than 90. मतलब acute angle पे branching हो रहा है. Usually 45 degree, 30 degree पे branching होता है. What is SPE standing for? They are all going to be septate. SPE को rearrange करो, they are septate. So if I zoom in, of course, I can see there are lines present. There are septa present. Look at the next one. Yes, beautiful. There are lots and lots of lines or septa that are present. And not only that, can you see kaisa branching here? One is going into two, then this is further going into two, this is further going into two, like a tree. So this is known as the dichotomous branching. So please note, aspergillus shows you acute angle branching, septate hyphae, and aisa tree ki tarah dichotomous branching. Now, what are the types of aspergillus that we have? Aspergillus fumigatus, Aspergillus flavus, and Aspergillus niger. Let me ask you the simplest question. Which is the one which is going to look black on agar also and is going to look black on the slide also? Of course, niger. Niger har jagah black. Niger word means black. Easy. Khatam. Bhul jao. Now let's look at fumigators. When you say fumigators, think of fumes, smoke and fumes. So firstly, what is the color of smoke? So smoke क्या होगा? You say मैम smoky color होता है. Color तो होता ही नहीं. Smoky. Fumes are smoky. So what is the color that you're seeing over here? This is the famous smoky green color. So the color that you see is smoky green because I'm dealing with fumes and smoke. And fumes हमेशा ऊपर जाएंगे. Fumes are always gonna go up, right? So if I look at the slide below, tell me if this is a vesicle. You know what you call this? ये जो structure है conical. This is a vesicle and you can see some dot coming on top of it. So are the dot present only in the upper part or are the dot present on the side also? You say, nahi ma'am, the dot are not present on the side. Conidia are only on the upper part. Why? Because fuels go up, na? Fuels are always going to go up. So conidia are always going to be upper part. Ho gaya yaad. Aspergillus fumigators, fume is smoky. So the color that you get is a smoky green color and conidia are going to be only in the upper part. Now coming to Aspergillus flavus. Flavus sounds like a flower. Flower means that the color of flower was beautiful. Yellow, green, ऐसा colors होता है ना flower का. So flower is going to have some yellow, green, nice colors and that is what I see over here. And flower is going to have petals all around. Flower is going to have petals all around. That is how I have learnt it. So the conidia are going to be all around. Let's do a recap. Fumigators, fumes are smoke, smoky green and fume will rise up. So conidia are only in the upper part. Flavus is a flower, beautiful yellow-green color and has conidia like a flower all around. Niger is har jagah black. Okay, now we say that is there any toxin that can come out of Aspergillus flavus? So remember, Aspergillus flavus may say there is a toxin called aflatoxin. Go back to pathology and medicine. What does aflatoxin cause? It causes hepatocellular carcinoma. Why does it cause? How does it get inside my body? So please remember, aflatoxin can be a peanut or a groundnut contaminant. And this is going to enter my body and cause hepatocellular carcinoma. How? By the mutation of P53. How will it mutate P53? At what codon? At codon 249. How do I learn this information? Dekho, P53 low and fill in the missing numbers. What are the numbers missing? 2 is missing, 3 to already hai, 4 is missing, 5 is already there. And P ka I can make a 9. So what is the codon? The codon is going to be 249. That's how I've learned it. Aflatoxin is going to cause hepatocellular carcinoma by the mutation of P53 gene at what codon? At codon 249. What is going to be the treatment for Aspergillus? We all know we need whatever lesion has formed. If it's an aspergilloma or if it is a cutaneous problem, we will need surgical resection. And for disseminated, voriconazole has recently been implicated. Now, once you've done Aspergillus, you are left with what? The other one. The other one is going to be mucor. So now mucor is very famous because you have entered into what? You have entered into the era of post-COVID black fungus. There is nothing black about it. It is not a black fungus. The black color was only because there was a black clinical feature. The clinical manifestation was a black tissue. Otherwise, there was nothing black about it. So mucor ka hyphae, how are they different? So now you will say, whatever I did for Aspergillus. Aspergillus was A for acute angle branching. So mucor is going to be right angle branching. I can see over here that mucor is going to have a right angle. It's coming out exactly at right angle, right? So right angle. Aspergillus was acute. So this is right angle. Aspergillus was SPE, septate. This is going to be aseptate. This is aseptate. This is all clear. You don't see any line inside it, is it? Also tell me something. If they ask you, which is broader? So remember, mucor is mota. Mucor is mota like a ribbon. Mucor is mota like a ribbon. So remember M and R. Mucor is mota like a ribbon. When it is mota like a ribbon, so if it's mota, it will not fit in my culture plate. Whenever I will try to grow, it will lift the lid. So if this is my culture plate, this is the plate and this is the lid. As soon as it will grow, the lid will start lifting up. So can I call them lid lifters? Can you see this cottony growth? But if you can't see it like this, because when you actually see a plate, you will realize that, for example, if this was a plate, you will see that the lid of this plate will actually lift up because it's mota, so it's going to lift the plate. So remember, everywhere, the fungus is going to look mota here, and because of being mota, it's going to be a lid lifter. And what is the treatment going to be? Again, a surgical resection and amphotericin B. And there's a very famous test now that has come up. That is beta-D-glucan testing and Aspergillus galactomannan. What are they done for? Many students ask me, ma'am, ye kyun karte hai? Why do you do these blood tests? What are they for? I say, no, don't learn what are they for, because they are possibly for every fungus on this planet. Learn what are they not for. Make your life simpler. What are they negative in? तो एक चीज तो याद रखो, both of them are never gonna come in mucor. So that black fungus era that came after COVID, neither did beta D glucan come or nor did galactomannan come. दोनों ही negative आते थे. So remember, Aspergillus galactomannan has been said for a reason because it is primarily a test done for Aspergillus. It is never gonna come in mucor. Beta D glucan is also not gonna come in mucor. It is not gonna come in three things. Bangalore Medical College. That is how we have learnt it. So where is it? Bangalore Medical College में beta D glucan said, I am not going. So beta D glucan said, I am not going to Bangalore Medical College. That is blastomyces, mucor and cryptococcus. Blastomyces, mucor and cryptococcus. So I realize mucor में तो कुछ भी नहीं है. Neither beta D glucan nor Aspergillus. The last opportunistic infection and my favorite, Pneumocystis carinii, or you can also call it Pneumocystis jirovecii. I've learnt it as 4 times PCP, 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 PCP. Means this causes Pneumocystis carinii pneumonia. If someone says that, okay, if you will do a bronchoalveolar lavage in this patient, what will you find? I'll say now we will call it another PCP, plasma cell pneumonia. So bronchoalveolar lavage basically shows you a lot of plasma cells. Okay, then they will ask you, acha, look at this under the microscope. What are you seeing? Firstly, tell me, why are they looking so black? Because what stain has been used? We have used any fungus looking black? Gomori methenamine silver stain. They're looking like round balls. They're looking like round balls, right? Yes, but sometimes those balls are also looking a little crushed. So what do I call it? PCP, another PCP. That is ping pong crushed. Crushed ping pong ball appearance. PCP फिर से हो गया. Crushed ping pong ball appearance on what stain? On Gomori methenamine silver stain. In fact, what are these crushed ping pong balls? If someone asks you, please note these are the cysts. So you say, hang on ma'am, you are talking about a fungus, and a cyst and trophozoite story you used to do in parasites actually. So which is the fungus which can show you a cyst and a trophozoite form? That is going to be Pneumocystis carinii. Finally, the treatment. Guys, what is the treatment? For P for Pneumocystis ka treatment, again PCP. First we prefer cotrimoxazole, and in severe cases we give pentamidine. So jaldi se revise karo. Pneumocystis carinii pneumonia, also known as plasma cell pneumonia, showing you the crushed ping pong ball appearance. Treatment of pneumocystis is with cotrimoxazole, and severe cases pentamidine. And yes, that's a tick mark to the mycology chapter. I told you it's an image heavy chapter. You do it once, but it's definitely going to fetch you at least 2 questions in your exams.